Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to the Auburn Medical Group live stream.
Welcome.
With Dr. Mark Vaughn and Dr. Gwen Vaughn.
That's me.
So we're talking about actions taken at the federal level over the weekend or just before the weekend. The laying off of 1,300 employees at the CDC and
1,500? 1,800?
Yeah, at
I forget what the number was.
The NIH. 1,500 NIH. So the layoffs continue.
Yeah.
In the name of efficiency.
Efficiency is what? Yeah, that is the name. What they are claiming.
So in reading Elon Musk's biography, well, I know there's a number of them. This is the second one I've read. Walter Isaacson, his biography.
Yes.
So he points out Elon Musk's technique for efficiency in car manufacturing, and then it also comes over into rocket engine manufacturing too, and it really is quite amazing, his approach to efficiency with mechanical things that aren't human beings.
Yeah.
Where he'll strip away things. You know, why do you put 3 bolts there? The stress is this much at this joint and this much here. Knock it down to just 1 bolt. And he'll do that. And he'll do that. He'll just ruthlessly go down the assembly line for the cars and take stuff away.
Yeah.
And here's the principle: you take away until you break it, and then you go, okay, we went too far.
Okay.
Which apparently works very nicely in car manufacturing.
In car manufacturing.
As long as you catch that it's breaking before you sell it to the customer.
Right.
And in rocket manufacturing, as long as you catch it during the testing of the rocket
before
engine.
people or
right.
important supplies are affected, yeah.
But with a public health system...
I'm not sure that's the best
How do you know when you've gone too far and you need to maybe...
Next
not
pandemic.
be as aggressive? Just a little thing to think about there for everybody. That may not be an appropriate analogy. We know that Elon Musk, of course, is a lot of the force behind the layoffs in the government. And
right.
I guess I would count myself among those that looks at it and goes, maybe we will feel some of this.
Okay.
Or not in a bad way. Maybe we'll feel it in a good way, some of it.
I'm trying to think the positive effect. I mean, the whole idea of this is to reduce government spending, right?
I believe so.
And what they consider quote unquote waste or fraud in some cases.
You also have to take into account the HHS secretary as of Thursday.
Well, actually, one of the articles I read on this said that these layoffs were at the direction of RFK Jr., not at the direction of the Doge office.
Okay.
So that could be something completely
going on.
Different. Yeah, because as I'm sure everyone is aware, Robert Kennedy Jr. was sworn in and is officially the director of Secretary of Health and Human Services, which oversees the CDC, the NIH, the FDA, which they haven't gotten to yet.
and I believe CMS also, Medicare.
For
Medicare,
part of that
Medicaid
as
services.
Well. You're right.
Yeah, so that's the topic for today. So let's see what comments and questions are awaiting us. Now, I'm not sure what to do with Missy here. Let's bring up her chat on the screen. I won't be able to make the live, so she put this comment in earlier in the afternoon. But why hasn't the medical community stood up for themselves and their patients? Hard to find a private practice and a doctor that actually knows their patients. So the first part of the comment seems like it could be taken in various applications. I thought it was a little I want to be a little more specific. So in the absence of that, I'll apply it to the lower part. So she's saying hard to find private practice and a doctor that actually knows their patients. Well, as far as standing up for private practice, I guess it's because we got kind of blindsided and we're kind of busy practicing privately rather than getting involved with legislature and and forming. Well, we can't form unions, but I think it's because we're a little standoffish in the political realm that now there's not enough independent doctors to really be heard. There are attempts at. I'm sorry, you go ahead.
Oh, I was just going to say, tell us what we need to do. I'm curious what you would like to see doctors do, and I can probably tell you point you to a area where that is happening. There's definitely legislature advocacy. We've got the AMA, which you may or may not agree with. All the CMA locally in California,
CAP.
So we do have groups that are working on our behalf, but historically and currently, doctors are overworked, and doctors really just care about what they're doing, taking care of the patient in front of them. Now, so we're going to do that as best we can. And what does that leave for us to do outside of that? Work through the AMA, work through legislative advocacy days, which you're a part of. We do have a lot of doctors who are a part of that.
Actually, we had Assemblyman Patterson here in our office 2 weeks ago.
That was just a couple weeks ago.
You met him, right?
Mm-hmm.
Okay.
Yeah, he was here. So, but I'm curious what you think we should do beyond that. We're happy to entertain those ideas and.
She can put it in the comments after.
Yeah, I guess as you watch this back, or anybody watching now, if you have other ideas. We rely on those. I mean, it's tough, especially in a small private practice like ours. We feel the effects of cuts. Yeah. But what do? Write our assemblyman, write our congressman, talk to our congressman.
Show them how it affects.
That which we do. And then we rely on larger organizations working on our behalf. Now, unfortunately, some of those organizations are not always smiling kindly on private practice. Some of them think we should just go away and assimilate to the larger infrastructures like a large group practice, which we have a couple in our area.
And then also for independents, we have independent physician associations, IPAs,
we do, which we're a part of.
Which work for or partner with some of the larger systems for the benefit of the patients of the private practice.
Right.
Yeah. And we should point out for those who aren't aware, and it sounds like Miss Missy is aware, of the benefits of, like she mentioned it right there, knowing your patient, the benefits of private practice or independent practice.
Yeah.
There was a great paper put out by, they call themselves PAC. Physician. I don't know.
No idea.
They are a PAC too, by the way.
Oh, okay.
Wait.
Well,
yeah, the CAP PAC. Sorry, I can't remember. But they've actually put out a paper last year, I believe it was, about independent practice, the value of it, and some suggestions for what to do. And I actually gave it to my assemblyman.
Right.
So that
if private practice were to go away completely, the price of your health care would go up dramatically.
No.
I think so.
I
think who provides the most affordable health care in our area right now?
Well, we do by far.
Private practice.
But
our patients would probably feel it.
No, the insurance companies would pocket it, and the patients wouldn't feel it. That's what I say. Lindsay Antoine, I have so much rage and anger regarding the dystopian nightmare we're descending into. I'm going to keep my mouth shut.
Well, that's not going to make for a fun episode.
Okay, Lindsay, thank you for your input. or not. But thank you anyway.
Thank you for your lack
Hilda, Does it affect your opinion that they are all probationary employees?
Well, let's talk about that a little more, what that means.
Hilda knows about what the title of the show refers to.
Yeah.
And that's the layoffs.
The layoffs.
I don't know if it's just probationary at NIH, but at CDC it was. It was
specifically.
It was like 45% of their employees in a probationary status, meaning they're still on their probation year of
the first year of
hire,
or first year of moving up to the next, getting a new part.
If they got a new position, if they moved within the organization.
That's the part that gets me a little. Sure, probationary, okay, first year. But if somebody's been there for a while and this is just their first year in that new position, they're affected too.
So Hilda, absolutely. I do feel better that it's not like the whole top being chopped off.
Yeah.
That would be more concerning. Although there were 2 resignations at the top of, what was it? I'm sorry, I don't remember if it was at the NIH. Sorry, I can't remember where it was. There were some resignations that occurred, seemingly connected to,
I would imagine,
the recent changes under the new leadership.
Yeah, which is
unfortunate. So that's something we need to take into account is who are these people that are being laid off? Mostly people that just started, not people who are in the higher levels, unless it's somebody who just got promoted.
Right.
And I got the feeling that a lot of them were fellows in a fellowship.
Oh, okay. I did not read that, but
the training programs, a lot of it was people being trained in epidemic investigations, the epidemic investigation
That's
service,
what I heard, that
EIS.
this affected that. The detectives who go to the source and figure out where
they were heavily
epidemics
hit.
start. Yeah.
So it was really training for them.
Sure.
It was like first year fellows. So people who right now we're not going to necessarily feel it unless there was a huge public health issue that occurred, like COVID again, something like that.
Yeah.
If it occurred now, we would feel their absence. But for the most part, it's kind of like, does taking this bolt away ruin the rocket engine? You wait and you find out, and it kind of depends on conditions.
I was going to say, when are you going to know that? You're not going to know that now while there's no active epidemic.
There was delay in us getting the information that antibodies to bird flu have been found in workers.
Yeah.
That MMR report was delayed. Remember when we were trying to find the MMR?
Yeah, that was a couple weeks ago,
the publication that comes out every 2 weeks by the CDC about what are they tracking and what's going on. And we were looking online for it, and we couldn't find it. That one finally came out, and it did show that bird flu is in humans, and we're only seeing it by the antibodies. So apparently some of them are either not reporting or they're asymptomatic, thankfully.
Probably. Yeah, probably just
okay, and then Hilda, Epidemic Research Department area. Yeah,
that's what we're
the EIS.
Mentioning there.
So a bit of a question as to will we see something and when? And chances are it would be down the line if these are training programs training the next generation of people who work in epidemic investigation.
That is the hard part. This is not something like a car where you can change and go out and test it once you've made it the next day or however long that process takes. This is something that takes a while, and that we're not going to see the implications of for probably years. So probably when the next administration's here, which won't be Trump, and then we'll blame that administration.
Something like that.
That's usually how it goes.
So there's a lot online about it. And one of the things that came up, vaccine discussion is a huge part of
it needs to be
this whole package. Part of it has to do with that the ACIP, the on immunization practices.
Advisory on immunization.
Committee on or is it committee or commission on immunization practices? They're the ones that make the recommendations for us, saying this is the official recommendation for the vaccines, and many insurances are required by law to cover those vaccines that this body recommends. So the future of the ACIP is a little bit in the air. Changes could occur there.
Yeah.
And then I was reading back and forth, particularly there's one ranking committee member in the House on the committee that has to do with Health and Human Services. I forgot. It covers a lot of other things. I think labor may be on it also. Don't know the name of the committee. She was writing kind of extreme about vaccines. And also, Mitch McConnell made a statement.
He was the one who voted against.
About voting against
RFK,
the
right?
confirmation of RFK, specifically mentioning vaccines, because he's a childhood polio survivor. He mentions that in it.
Yep.
But both of them, there was something that made me uncomfortable with fully endorsing their statement. And it comes from them speaking about vaccines specifically, except not specific. They use vaccines as a single entity, and they speak on it. They talk about reworking or relitigating the science. That whole thing about the science is determined and it's done. I totally am of the opinion, from my educated perspective, that the vaccines that we're using here are good for the purpose they're used for. I use the word safe in quotation marks.
They're safe.
I think of The Lion, the Witch, and the Wardrobe. Aslan, is he safe? Nobody's good. I think that could apply toward vaccines.
Sure.
I hate overstating or generalizing vaccines and pretending there are no side effects, that there are no people who have been hurt by a vaccine, that there's never been a vaccine injury. That's not the truth. But the truth is somewhat nuanced, and that is
what nuance?
The incredible amount of good compared to the minute risk of bad is so. The gulf is so wide, so wide.
Yeah.
That I just hate that we have to even admit that there is something there that people can
latch on to,
make a
bigger
mountain out of these molehills that are so irrelevant compared to the bigger truth of the effectiveness.
Well, yeah, and when you compare the risk, not the risk, but the vaccine injury, which is a thing, it is out there, with what the consequences of not vaccinating. It's not close either.
Oftentimes for the
disease.
Exact same injury too.
Yeah. So,
well, you could say the myocarditis in the young men.
Yeah, which actually happens with COVID when you get the disease. Or the very, very rare MMR vaccine injuries versus encephalitis and death. Encephalitis in 1 out of 1,000 people. Yeah, that is significant. In measles. In measles is what I'm talking about.
Something that's
the disease
more contagious than anything we've been around.
Yeah, because
our generation.
We haven't really dealt with measles because of the efficacy of vaccines.
Yeah, people from before remember, wow, you're just in the same room with that person, you're walking home with measles. I mean, it's that contagious. And like you said, 1 in 1,000 encephalitis.
Yeah.
And what was the rate of orchitis, where people would be sterile?
Oh, for mumps.
For young men?
Yeah. Oh, gosh, I don't know that. I don't
know. Mumps. I'm sorry, that was mumps. Because we put measles, mumps, rubella together. I always think of the...
Right.
So the point is, yes, we are taking into account those things, and we've moved past that. And as far as the science being done, the science is never done. I don't like that statement.
Yeah.
We always have to be open-minded and look at the data again. And we've been doing that. and
it's reconfirmed.
And sometimes you do see something new, like, oh, that Janssen COVID vaccine did cause some blood clots in women.
And it was taken off the market.
And it was taken off the market because we had safer vaccines.
Other vaccines.
Also, we have to, when we talk about COVID, we really are talking about almost two different diseases between the COVID that killed
from 4 years
million
ago
people
versus
in the United States in 2020 and 2021
versus today.
And what's going around now.
Sure. Yeah.
And part of that is it killed off all the easy kills.
And it mutated to a less virulent, which is the natural course of a virus. Yeah. So.
Well, unless it goes the other way. But
and
natural course being it kills off those who are susceptible.
Yeah.
Unless it mutates in that direction.
Right.
Yeah.
Right.
Of course, that's not in favor for the vaccine because then it doesn't have any hosts to replicate in to keep spreading.
Naturally, it wants to keep people alive so it can infect more people. Those are the ones that
and we use the word want. We don't mean it actually has a will.
Yeah.
What we mean is the result of it killing itself off. Essentially, it's host.
Yeah, it's essentially we're talking survival of the fittest here. Yeah, the whole evolution of viruses.
Yeah. So. Yeah, natural selection. Okay. Oh, actually, we are caught up on the comments.
Oh, there's one.
So I'm sorry, I've been interrupting you a number of. Oh, you have one there.
I wonder if COVID caused a surge of overstaffing at the CDC. Probably is what you're talking about. That maybe they haven't. That's possible.
Let's talk about that. So
I actually do not know the answer.
I think it was. I think it was more a matter of it was understaffed before in addressing epidemics. And that's probably, I don't know this for a fact, but my guess would be that's where a lot of this growth of the Epidemic Investigation Service came from. Yeah. Did they overshoot and err on the other side? I don't know. Maybe. If so, then it'd be appropriate to do some cutback.
All right.
I honestly don't know.
Yeah. The tough thing is you're not going to know until the next epidemic. So it's one of those unknowables.
Yeah.
I guess you can maybe look at the last epidemic and do some.
You say next. What do we have currently? We currently have
flu.
Big influenza.
Yeah.
Bird flu. Mpox in DRC, I believe it is.
Yep. Measles in multiple locations in the United States.
Unfortunately, yes. It used to just be one. Yeah. Not only measles active in Pakistan and I think somewhere in Africa too, but measles antibodies or maybe it's DNA fragments being found in wastewater in some Western countries.
Yeah.
So without cases, though. How come you had one that I didn't?
I don't know.
What's the deal there? Did I lose my comments? And of course, we have Darla saying hello. Thank you, Darla. We appreciate that. And we also have, there was another one. Oh, Laura Webb saying good evening. Thank you, Laura.
Good evening.
We do see that you were there and commenting on the interwebs there. Okay, Lindsay, it's your turn. Go ahead.
Let it go.
Just let her rip.
We ran out of everything. Time for you to not keep your mouth shut.
Give us some fodder here, Lindsay. We know that you've got it. We know you're just holding back.
We're still early in this, so it's going to be interesting to see where this goes over the next few weeks.
Adjust back the other direction. So
Who knows?
But we will be talking about these issues because we're interested in it, and it does affect our patients and our viewers who are, our viewers who are in the U.S., not so much those who are in the U.K. or Australia or other countries that they're watching from. So at 4:54, oh, here we go. This is what we've been waiting for. Lindsay, thank you.
We don't
have enough airtime to hear all I have rage about.
Oh, man. Rage tweet it.
So for those of you who don't already follow Lindsay Antoine on social media, now's the time to subscribe and follow. That way you don't miss out.
Let it go.
Everything that she has.
Release the
Hilda. Here we go. Hilda's also got something. Mandatory vaccines, question mark. My cardiologist today would have canceled my appointment today without a flu shot.
Without a flu shot? I have never heard of that happening.
Wow. Well, flu could be hitting some communities harder.
So hard.
Than it is. I had a positive influenza today, this morning.
Yeah, a few weeks ago. 2 weeks ago, flu was so bad at my kids' school that they canceled Thursday and Friday.
We've been having lots of positives.
I think I said earlier, 30% of the kids were out with flu. Somehow my family escaped it. I'm going to knock on some wood and say, hey, we're vaccinated.
So Hilda wants us to comment on that.
That's mandatory. So, well, let's talk where this was maybe even more prevalent was with COVID. And we kind of saw the outcry of a lot of freedom Americans, or Americans who didn't like that. So I don't think I've seen that.
There's places where you can do it, like
there's places where it's appropriate, like in if you're going to be coming in contact with other immunocompromised individuals,
working with I think there it's appropriate to have that as required.
I think at the hospital they require it for all the nursing and other staff there.
And then you can see the cardiologist doing it. Of course, we don't know who else that cardiologist is treating, but seeing themselves as a potential vector to other patients.
Sure.
I can see why they would.
I can make a case.
Yeah. I would put it that way.
But we have not done that. I'm trying to think.
No, but how do you feel every time you try to tell the benefits of vaccination to a patient
and they decline?
And where it is frustrating. And what's the reason for the decline? I don't know if you do.
I don't trust vaccines. Ever since COVID. That's what I've heard. The increase in vaccine distrust is disturbing.
And again, where is the source? Maybe you can tell us. Where is the source of that information? Where is it coming from? Fox News?
That's
the behavior of President Trump in his first term when he was the one that we have to thank for Operation Warp Speed.
And when he got his vaccine before anybody else.
So where is that coming from?
I don't know. It's a lot of... Yeah.
Okay. So, Lindsay, I like to think I'm angry about good, important things because I care about people. Thank you, Lindsay Antoine. We appreciate you caring about people and cats.
And cats.
Yeah,
oh, cats.
She likes the cats. Okay.
Cats are great.
Okay, so thank you for putting up with our ranting. I hope that we kept it somewhat moderated. We tried.
Yeah.
Some. We don't want to alienate people. We want to have dialogue.
I hope conversation is good. We're happy to have conversation.
The balance we're striking. Okay, thank you, Lindsay Antoine. Thank you. And Dr. Wayne, thank you. Until next time.
Hey, I'm Dr. Wayne Baugh. My name's not there.
Oh, you want?
I was pointing to my name.
Right? Yeah, there you go.
That's me.
And Dr. Mark Vaughn. And Dr. Vaughn, if you want to listen to music on Spotify or whatever streaming service, stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.